Hello. Today I would like to speak about a common gynecological condition affecting women called fibroids of the uterus. Fibroids are also called leiomyomas in medical terminology. They're essentially nothing but benign, which means non-cancerous lumps which form in the uterine wall. So the uterus itself has a muscular wall, and these little lumps form in the wall, and they can be of any size. They can be as small as a pea, or they can be as big as a football or even bigger. So depending on where the fibroids are in respect to the actual muscle of the wall, whether it's inside the uterus, in the wall, or outside the uterus, and also depending on the size, they may cause various problems. These fibroids, if I scan about 100 women, 30 to 40 women are likely to have fibroids of various kinds of sizes. As I said, they can be small or big and differ in location. So they seem to be more common in the age group of 30s and 40s. But once a woman undergoes menopause, because there are no hormones to sort of help it thrive, they usually shrink in size. So depending on the location of the fibroids, women may face various issues. The common symptoms are heavy menstrual bleeding, especially if the fibroids are submucous, which is within the uterus, uterine cavity itself, or very large intramural fibroids, which are within the muscle wall, and that can lead to heavy bleeding as well. The other problem is pressure symptoms. So when the fibroids are big enough, they may cause a certain kind of pressure down below, make you pass urine more often, or make you want to pass motion more often. Or they even may cause pressure on the tube which connects the kidney to the bladder, called the ureter, and then cause swelling of the kidneys as well. Fibroids can also cause pain during periods, and the pain can be there during intercourse as well. They may or may not cause issues with fertility, that is in terms of actually falling pregnant, because of the location of the fibroid. So suppose the fibroid is actually sitting at the neck of the womb or sitting at the entrance to the tube from the uterus, they may cause some issues with subfertility. Once the woman conceives, depending on where the fibroid is situated, there's a slightly higher risk of miscarriage. There's a slightly higher risk of issues during the pregnancy, especially if it's a big fibroid such as preterm labor, and another condition specific to pregnancy called the red degeneration of the fibroid, wherein the fibroid becomes a little softer and may cause pain during pregnancy. Also, during the time of delivery, depending on where the fibroid is, the delivery may be an issue, especially if the fibroid is at the neck of the womb and it's of a significant size, in which case it might obstruct a normal delivery. Sometimes the fibroids may change or alter the shape of the uterus, and the baby may decide to change the position and not come head down in the 9th month. So it might be transverse or in breech position because of the presence of the fibroid. In any case, fibroids are diagnosed quite easily when a woman comes and sees us. Once we take the history and examine them, we internally examine as well and figure out whether the uterus looks slightly bigger and whether there's any possibility of any lumps in the uterus. Then we organize for an ultrasound scan, and the radiologist is very easily able to tell us whether or not there are fibroids, and if so, whether it's a single one, and what is the size of it, and what is the relation of it to the uterus and to the lining of the uterus. Sometimes we even have to do MRI imaging, magnetic resonance imaging, in order to figure out more details about the fibroid as to the location, the distance from the inner lining, and also about whether or not it's a fibroid or something else like an adenomyosis. So once we have figured out what is the number of fibroids, the location, and what are the symptoms, we then discuss as to whether or not this requires treatment, whether it just requires observation, in which case we do regular scans, say 3-monthly or 6-monthly or a yearly scan, or whether it requires medical management. Many a times with heavy periods or pain during periods, all the lady may require is some medications to reduce the amount of bleeding and some painkillers during the flow. Sometimes it may require certain hormones in order to help it shrink down. And sometimes it may even require a surgery, especially if they're causing symptoms and they're fairly large. There's an anticipation that they may cause trouble during pregnancy. So if there's a single fibroid, just a myomectomy can be done, which means just removing the fibroid and conserving the uterus for pregnancy. And however, if the lady has multiple fibroids which are causing trouble and she has completed her family and more towards menopausal age, we may even decide upon a hysterectomy, which is removal of the uterus along with the fibroids and the neck of the womb. In terms of the medical management, there are certain medications which may be used to shrink the fibroid, which are long-term medications, and during the use of these medications, the lady may not have a period. So all these options will be discussed in detail when the lady comes in with an issue of a fibroid uterus. The other more rarer forms of treatment are related to uterine artery embolization, which is actually blocking the uterus, blocking the artery, which actually supplies the fibroid with blood. And there's also another way of using high power, high energy in order to shrink the fibroid or completely let's say blast it off. So these are more of rarer ways of treating, and long-term results for these treatments are awaited. However, the more commonly used medications and surgical techniques are, as I said, certain medications including hormonal and surgical techniques such as myomectomy and hysterectomy. I hope I have been able to throw some light on the issue of fibroids in the uterus for women. Thank you very much for watching.